We have a guest. Might be our presenter tonight.
Number two, they're not two.
Pardon?
Number two.
Yes.
Okay.
Yeah.
Because I was gonna say I got excited briefly when I saw that it was called Variances. Like this is gonna be a cool statistics presentation, but then I looked at it, it was still interesting, different.
Yeah, I got some numbers in here.
Okay, so, need a motion to adopt the, and a second to adopt the consent agenda and the last minutes from the last.
So moved. Second.
Any additions, correction to any of those? Okay, all in favor, say aye.
Aye.
Opposed? Okay, the motion is passed.
Jane, if I could just say something about the monthly activity report. Because we had a lot of stuff in this packet to read this month.
Yeah.
It was also good. But the foundational capabilities in the monthly activity report, if you didn't read it, please take the time to read it. It is excellent. The information in there that Melissa and the team has put in there about what's happening in Ohio, and that affects public health is need to know information. So please take the time to read it. And I just thank you, Melissa. I got shivers. I really did, because there is so much going
So
on
much change.
and so much change,
Yeah.
and it is not necessarily good change for public health. So we need to be strong, and we need to be advocates, and we need to be knowledgeable about it. So I just didn't want that to pass up.
Thank you. We have two presentations tonight. We have Camille talking about youth tobacco and vaping, and then we have Shadrach talking about variances. So, you know, right?
Good evening, everyone. As mentioned, I'm Camille Edwards, Health Education Program Manager, and I'll be sharing about our youth tobacco vaping efforts this past year. So next slide. So I'll be going over our Advocacy Through Art project, the Color Walk, 2025 compliance checks, and then some next steps like moving forward, what we're looking to do next. So first I wanted to start with some data on kind of like why we're focusing on youth right now. So this is 2023 data from the Youth Risk Behavior Survey that shows vape usage in middle schools in Ohio. And what we see here is that 6.4% of middle school students reported current use of vape products, with the highest being among females and 8th graders. Next slide.
Email.
Yes, that was interesting, wasn't it? Yeah.
Using it for dieting.
Yeah, I don't know on that part. So then this slide here from the same data set, we see that nearly 68% of youth who had tried any type of tobacco product started with vape products. So a clear sign that this is kind of like an entry point for a lot of youth. Locally, we have seen an increase in adult vaping from our 2020 child to the 2023 child, with a 5% increase. And even though that is adult vaping rates, we know from this type of data that it is starting in those teen years. So that's why we're kind of trying to focus on youth. Next slide. So our Advocacy Through Art project, this focuses on raising awareness about the harmful effects of vaping, with a focus on youth kind of driving the charge on this project and promoting cessation services that are available for youth. This was our third year doing this project as part of the ODH Tobacco Use Prevention Cessation Grant. And it's really a good way to let youth be creative in creating artwork and things to start that conversation around vaping. They do have their hands like on the project from the very beginning. They're able to have a lot of input on it. And for this past project, we met monthly from November to April. We had 16 youth participate. And we did include some education in the beginning of it just to kind of set the stage on why we're doing this. So education included impacts of vaping, youth advocacy, and how art can be used to advocate. Additionally, we wanted to give the youth opportunities to take this conversation and topic of advocacy and put it into practice. So they did have opportunities to go on a morning show on, it was ABC 22 Fox 45. It was a morning show. They had live TV. And then they also, a couple of them participated in our GCPH podcast. And I did include links to that in the slide deck that Olivia sent if you guys are interested in taking a look at that. But they were really excited about that. Very nervous, but they did a great job. We had a 7th grader and a 9th grader, and they just did really well. And they thought it was so cool. They got to miss the beginning of school to go be on TV. Next slide, please. And so the color walk was kind of the culminating event for that project. In past years, we did some like a health fair type of thing, and then we did something at the mall. But every year we try to engage community members and raise awareness on what we're doing. And this year they had decided on wanting to do a color walk. And so the idea that I had to kind of try and engage all of the youth, because everyone's got different strengths, different, comfort levels. So I offered 3 different planning groups, education, creative, and logistics. So the education station, a planning group, they created different activity stations that were going to be offered at the color walk to give people like an opportunity to see the physical impacts that vaping has on your body. So one of the stations was a hairspray station of like the aerosol and like how that like is what you're taking in when you're vaping. There was a slime station of like put your hand and that's like the feeling of on your lungs. And then there was one where we had like weight vest, and so they could do like some high knees or some type of jogging, and then it would show like how hard it is to breathe as those effects. And the weight vest, you could change the weight, so we could do it for take all of the weights off and have a kid do it, or load it up if we had an adult that wanted to participate too. The creative station was for my kids that were like really talented in drawing. So they mocked up some different logos, and we took those logos that we were going to put on the t-shirts, and we digitized it, and then we took it back to the group, and they kind of gave their sign off on what colors they wanted, what they liked about it, didn't like, things like that. Same kind of process for the flyers as well. And then the logistics group was my kids that were kind of shyer, didn't really want to talk, would have probably just sat there and not did anything if they didn't have to, But this was kind of like an opportunity for them to, plan that logistics of it. So we had a map of the YMCA walking trail, which is the ZNY, that's where we had the event. And they were able to map out where the stations would be and how the event would flow and something like that. So they could still get involved and contribute without having to be artsy or talk a lot. And so also the group as a whole put together a lot of quick kits, which included quitline information, gum, mints, things like that, coloring pages, all those different things that are used for people on their quit journey. Next slide. So for this project, we worked with Family and Children First Youth Move Group, but in addition to that, we brought in the YMCA and Central State University Extension Office. As I mentioned, we had the event at the Xenia YMCA, so we also used that CSUE side of the building as well. So they contributed to a lot of the planning process, offered staffing and some resources, and then along the way, United Way of Greater Dayton reached out wanting to sponsor the event. So they donated $500 and a lot of color powder as well. And then from the pictures, you can see some familiar faces on there, I'm sure. And then, but you can kind of see like the range of people that came and participated. So we did have like the young ladies on the far right that, there was adults that wanted to come and participate. And then we also had kids that were very eager to participate too. Next slide. So registered versus who actually attended. This event, registration just took off in this event. We had over 200 people register. Unfortunately for us, the event happened to be on a weekend where we had like record rain in Ohio. So That was very unfortunate, but we still had over 100 people show up. And of that, 52 youth under age 18 showed up. So we were still able to reach that target population, in spite of the weather. A lot of people were concerned about if we were still going to have the event. So if not for that, I think we would have had even more people show up. Next one. And in addition to the actual walk, we also did a health fair. And what was interesting about this is that all of the vendors that attended this health fair were in areas specifically selected by the youth group. So they picked the topic areas that they wanted based on what they knew would resonate with their peers. And then we put together the list of vendors for the health fair. But again, this was just another way of how the youth really had their hands on the whole planning process. And then vendors were encouraged to bring giveaways and have like interactive activities for the families as well. Next slide. And here's just some of the feedback that we got from the youth participating. It's kind of like just a summary, but overall, the youth expressed interest in participating in the project next year as well. So we were very happy with how it turned out. Next slide. And now switching gears a bit to the 2025 compliance checks. Next slide. So the compliance checks were completed in April. We were given a list of 120 stores from ODH. The data from the compliance checks was collected via a red cap survey provided by ODH. And then the compliance checks were completed by underage purchasers with supervision of a GCPH health educator. Next slide. So of that 120 stores on the list that we were provided, we actually checked 111 of those stores. Oftentimes it's due to like a store closing or something like that, why a store isn't actually checked. Also, they're advised that if someone doesn't feel safe, the underage purchaser or the health educator, then we don't check that store. But I don't think that we had any of, like that was the reason for any of them. I think it was just the stores not being there anymore. Next slide. So we had 2 underage purchasers, 2 young men who completed all of the checks for us. They were trained prior to, again, with safety being a priority. They stay in constant communication with the health educator while they're on those checks. So they usually have a headphone in, and that way the health educator can hear if something is going south with the check, and then they can intervene if necessary. They are advised to be truthful and honest at all times. So no lying about their age, no trying to like appear older or anything like that. And then there were no citations issued, but the respective police departments were notified of any failures in their jurisdiction. Next slide. So of the 111 stores that were checked, 65% of them were chain establishments, which is kind of what we would expect, being that there's no like tobacco retail licensing or anything, so stores can kind of pop up. So most of the ones that they're able to know are still there from last year are usually the chain establishments. Next slide. This is the characteristics of all the stores that were checked. It is self-reported by the underage purchasers, so it's not exact because some people could look older or look younger, but it gives us a general idea on the age piece, particularly. Next slide. For age verification, so it was reported that 100% of the retailers did have a visible sign indicating that it is illegal to sell to anyone under the age of 21. All of the stores, the youth reported that they had to actually ask the clerk for the product, so it was behind the counter. And then 93% of the stores asked for ID. That's a typo. It's not supposed to say only 92% asked age. But that's verbally asking, and 92% was a huge improvement from last year's only being 10%. So improvement on that. Next slide, please. This shows the passing rates from 2025 compared to 2024, and we see a huge improvement. So we're very happy about that. Next slide. Of these stores that failed, there were 13 stores that sold to the underage purchaser. 46% of those 13 stores did not ask for ID at all. 7 of them asked for and examined the ID, yet proceeded with the sale. And then 3 asked for ID, verbally asked age, scanned ID, and yet still proceeded with the sale. Next slide. The characteristics of those retailers, majority of them that failed were gas stations or with gas stations with convenience stores. And then 31% of the fails occurred in places where people under the age of 21 had no legal reason to be in there. So a tobacco vape shop or like a liquor store, things like that. Next slide. The clerk characteristics of the failed retailers, 92% of them were in that adult category, and then the rest were in the senior adults, which means that none of them were in the young adult. Again, that's all just self-reported by the underage purchaser. Majority of them were females, and then there was no significant difference in age or gender of the clerk likelihood that they would ask for ID. Next slide. This shows the compliance rates since we've been doing the compliance checks. And with this 88%, that is the highest since pre-COVID. So definitely heading back in the right direction. So of the repeat offenders, 49 of the stores that failed in 2024, 26 of those were checked again in 2025. 4 failed in both 24 and 25. 3 that passed in 24 failed in 25. And then 41 of the stores passed the compliance checks in both 24 and in 25. Next slide. So after the failed compliance checks, all the notifications, all of the retailers received a notification that their store failed. We used a template that was provided by ODH to send those letters, and it included information on Tobacco 21 law. And then, as mentioned, we also notified law enforcement of the failed location in their jurisdiction. Next slide. So path forward. Unfortunately, due to federal and state funding cuts, Greene County was one of 14 counties that did not receive ODH funding for the tobacco grant. And so there was also a number of counties that only received partial funding as well. And so we know that these funding cuts have really impacted public health programming and grant initiatives as a whole. But despite some of these challenges, tobacco has seen some small victories on like the policy front with a Franklin County Court ruling that local governments do have the right to create their own tobacco regulations. And so that opens up the door for bans on flavored tobacco and tobacco retail licensing. However, the state is expected to appeal this decision to the Ohio Supreme Court. So it is a small victory, but the fight's not really over yet. But so what for us, we've had to kind of pivot a bit with losing the funding, and then we do not have a dedicated tobacco health educator at the moment. And so we find ourselves with an opportunity to kind of get creative with how we continue the work. So definitely continuing to provide resources for the Quitline outreach and things like that. But when it comes to like the youth piece of things, we're trying to figure out how best to navigate that and move forward. And so what we've done so far is kind of talk with ODH and see how they can continue to support the work. We're going to continue participating in like the Tobacco Free Ohio Alliance so we can stay connected to other people doing the work and learn more about hopefully like funding opportunities and things like that. And then we're also looking to see like what partners in the area are doing in that space of tobacco prevention and how we can continue to like expand reach without like duplicating efforts. So that's kind of where we are, trying to just, like I said, get creative and see how we continue to spread the word and do the work, really. So that's all. Next slide. That's all that I have. Yes.
Fortunately, when I was your age, you never even thought about this. People, young kids vaping and all that. I realize now Ohio is still saying you have to be 21, but yet there's so many young kids that's doing this. Okay. But I see a lot of the states now has reduced their limits down to 18 years old instead of 21. Do you foresee Ohio doing that? And so what are we going to do to cut that off? Because, all I got to do now is worry about my grandkids going to school and all this vaping and all this other stuff is going on. And if the kids are doing it, I know the adults are doing it. Okay. teachers, not sure, okay, but then the kids are doing it. Somebody needs to stop this. It needs to stop. I realize you don't have the money because the funding's been cut, but there should be some other resources out there that we can hook up with to eliminate this, because it's ridiculous.
Yeah, I actually have not heard from like some of those meetings that they're leaning towards going back to 18. So I'm not sure about that part, but definitely I think what we learned from that youth group and just asking like where they're getting it from, a lot of them are getting it from their parents. And so I think that just furthers the need for like education for the parents too, because they're thinking that they're doing something safer for their kid. Like it could be worse, so I'll get them this so they don't do something else. That's what the kids are telling us that they're hearing. So I yeah, I hope the age doesn't go back to 18 for sure. But yeah, I think just definitely needing to educate them on the dangers of it. Yeah.
I have a quick comment too. I have a couple of my girlfriends who quit smoking to start vaping, and one of the things that they like about the vape is that they don't smell like the tobacco, you know? They can actually hit it in the bathroom and nobody knows that they're smoking, you know, while they're working and stuff. So, I mean, I'm sure it's the same thing with guys, but you know.
Yeah, and I know that the being able to hide it is a big thing with the kids too. Like I didn't even know there's like hoodies and stuff that like again like
Yeah,
smoke it out of
Yeah.
like yeah, that's crazy.
We know what vaping does to adults, and only my good doctor here can talk on what vaping is going to do to these kids.
Yes, I could.
Welcome to public health, world public health, where everyone loves what we do, but no one wants to pay for it.
Yeah.
But nothing stops us from finding partners and having passion about issues like this. So, you know, we just found out July 1 that funding was gone. And it was $130,000 that was taken. But immediately, you know, Cheryl and I, Camille, have all talked about, you know, it's a new game plan. We can go about this. We can partner. You know, we have some leftover supplies from before. We can see who else might be interested in working on, or, I mean, I'm certain the schools would be interested in doing this. And then it's up to us to be wise about how we use the taxpayer dollars that are given to us and determine if we need to fund a position. You know, that is where the levy dollars go, is to support this community anyway. So if that's something that we need to do and we don't find funding quickly, that's what we do, is we fund part of a position to make it happen. We started many programs that way.
You know, because one day we all will be gone, but our kids will still be here.
Yeah.
So we need to do something for them so that they are able to live a blessed and normal life.
I don't know, you know, as far as the laws, you can see now how many laws in the NAR, the monthly activity report that come out, and it's like you're always on guard watching, because you never know when someone might propose reducing that age for selling tobacco legally. So that is part of my job, you know, is to constantly be sifting through what the House doing, what is the Senate doing, who's talking about this. And really, we have to educate our legislators now to make sure that something like that doesn't happen. So we reach out and talk to them.
Well, there's no doubt we've got the awesome administrator here, the director that takes care of the
No one's
health
done a
department. Commissioner takes care of the health department, so I know we're gonna be all right.
But you know, there's other voices too. So nothing stops anyone in this room or anyone in the community from saying, "Hey, I want it to stay 21. Let's keep it 21."
We have 3 members that are on Zoom with us tonight. Do you have any questions for Camille?
How can you tell?
I have, can you guys hear me okay?
Yes.
Yes. Yeah.
I have one comment and maybe two questions. Anyway, one comment, I love the presenter's attitude, the health department's attitude about losing this funding and still saying we have an opportunity to be creative. I don't think I've heard that one before, and facing an elimination of funding of that size. So that's a great attitude to have. One question, or one of the two questions I have, when you do this surprise visit out to the stores, do you give them any heads up, maybe a month beforehand that this happens, or is this part of just 100% no notification to them?
Oh, so we notify law enforcement, but we do not notify the stores at all.
Okay. And my last question is was there a reason given to the elimination of the funds?
Just the cuts, federal and state cuts is what they said. They in fact said that we met the scoring requirement to be funded, but they didn't have any funding to give, basically.
Okay. Thank you.
Thank you. Anybody else? Okay. Thank you very much.
Thank you.
Good job.
Chadwick?
Yeah, Todd raised his hand again. Is that an accident? Mr. Todd, did you have a question? Your hand is raised.
No,
our
I
team.
know. I'm sorry. I meant to
Oh,
hit
no,
the
that's okay.
mic and I hit the raise the hand.
Gotcha.
I'll get the hang of this and hopefully.
Yeah. Well, thank you everyone for a much quicker presentation here. We didn't want to wear you out all in one night, but we did want to spend a few minutes talking about variances. You probably noticed since my tenure that this body has received a variance more often than not each month. And I kind of wanted to explain myself why the change, what variances are for, and why we so often need your input. So next slide. I figured the best place to start is at the beginning, of course. I don't mean this to be patronizing, but a little background on how a bill becomes a law, right? Usually a legislature identifies a particular need of public life that needs regulation. And so they adopt a law to promulgate a set of regulations, right? In Ohio, we refer to the law as they're recorded as the Ohio Revised Code. And then the regulations that come therefore are from the Ohio, wait a minute. What is the Administrative Code? Thank you, Melissa. Yep, the OAC. Now, when the legislature adopts a rule or a law to promulgate a set of rules, they usually task a specific agency to do that. And so that agency will confer among themselves, gather subject matter experts, either internally or externally. Hopefully they sit down with the affected citizenry or the corporations or the particular segments of the population that they're regulating to talk and get their input. Because there's no better rule than a rule that has buy-in from the very people who are set up to obey it, right? So after all that's done, the agency runs that through internal checks. Their lawyers will make sure everything matches the way that a regulation is supposed to be set up in form and function. It's given back to the legislature, usually as a subcommittee or a committee, and then the rule becomes adopted and is then enforced. Next slide. Generally speaking, we know that those statutes carry more weight than the regulation, and I would imagine especially in the legal sense. That's the way we've been talking about it. So again, in Ohio, an ORC is the law, and OAC is the regulation or the rules. And in our realm here at the health department, generally we exist within the realm of the OAC with a couple of exceptions, especially in environmental health. Next slide. All that being said, regulations are never one size fits all. That is especially true when it comes to public health. when you think about the regulations that a government sets up, oftentimes they regulate corporations, businesses, other agencies. In public health, they're intended to govern individuals, right? Homeowners, sole proprietors at a restaurant, for instance. And when that is the case, you have much more opportunity for variance, that is, for differences in situations from one to the other. Next slide. And that leads to a situation where inevitably there will always be a case where the letter of the law defeats the spirit of the law, right? Where we run up against bureaucracy that actually undoes the very point of the rule. Next slide. And so, generally speaking, most regulations come with an opportunity for variance, for an official ruling by the governing body to decide that a rule needs to be adjusted or bent just a little bit. Next slide again. So for our purposes, and with all due apologies to Mr. Root as the actual legal expert here, we would think of a variance kind of in these terms: an official way to grant an exception to a specific rule to fit a non-standard situation. That's how we think of variances here. Next slide. And so we come to why this body is now hearing more variances than they have in the past. It used to be, and I'm not throwing anyone under the bus, but in olden days, a lot of times management didn't even hear about the exceptions to the rules. Sometimes they might be given a wink and a nod or a little pencil whipping, and so you didn't know about some of those things. Now, we're not talking about gross violations of the law, but when that happens, it's real easy for an agency to get away from its actual official mandates. That's why variances are so important, because they prevent a department by what I call ruling by fiat, right? From having a little Napoleon, a king of environmental health or one of the other agencies. If you read the rule, you realize that the spirit of the rule is that a property owner, especially in environmental health, actually has a right to appeal a rule to the Board of Health. And we want to respect that. And that's why you get to hear these situations so often. The other advantage is that when a decision is made, it carries the weight of the authority of the Board of Health, not whoever's in charge at that particular time when a situation comes up. As we're talking about this, and I probably should have said this at the outset, I have in my mind maybe sewage system things, well things. Those are the kind of situations that all come up here. That's the kind of thing we're talking about. Sometimes there's variances in food rules. That's a little different. But those are all things when the time comes that the board needs to speak up. And when we do it the right way, then everything's being done fairly and transparently, in a public meeting like this. So everyone can see that they're being, the rules being applied to them just like everyone else. Next slide, thank you. A couple of things that we do want to keep in mind about variances though, and the way that me and my staff think of them. A variance is not intended to set aside an entire regulation. You can't vary the whole rule. It doesn't exempt anyone from the spirit or the intent of the rule either. We can't vary other laws and regulations that aren't a part of what's going on in the immediate term. It would be too complicated to give you examples of that, but sometimes that may happen when sewage rules overlap wells, like if one is encroaching on the other. Or it doesn't allow us to infringe on other agencies' rules. For instance, let's say that we have a rule that says all septic components have to be 10 feet away from the property line. Well, this body may be able to say, yeah, you can be 5 feet away from the property line in this situation because of this circumstance or whatnot. But if there's a zoning rule that says that a house has to be 10 feet away, or whatever. We can't vary their rules, right? We can only work inside our realm and within the authority we're given. And so from that also, a variance should not be applied arbitrarily. We don't give special privilege to one person or another. It's not used for convenience or for minor cost savings. Now that's where my role comes in and my staff, because we're going to do our best to convince clients who are trying to use a variance for that purpose that that's not what it's for. If there's a way to do it the right way, that's the way we want to do it. And finally, it should never really be a routine part of any of our operations. A variance is supposed to be a special case. So we shouldn't be seeing requests for variance from every single well drill or every single sewage installer or designer. It really should be, again, a special case. Next slide, thank you. Interestingly, rules also often prohibit variances. We have an example of that here in the sewage rule, where it says that leaching trenches can't be too deep in certain soils. And that's because it's not an arbitrary rule. There's hard science that says if you put the leaching down there, it's not going to work. It's going to contaminate the environment. So sometimes those are called out specifically. Next slide, thank you. So why does my team especially petition the board or support petitions to the board for variances? Usually it relates to setbacks for wells and septic systems. That's the most frequent thing. So briefly, the rule says that all parts of the septic system have to be 50 feet away from a well. There's nothing magic about 50 feet. We've got to have it a certain distance away. So we say 50 feet. But there's no science that says that 48 feet is just as good, or suddenly everyone's going to die or be contaminated because of that number. So that's an example of something we might bring to the board. You should know, of course, that, again, me and my team think of variances as a last resort. We're going to do everything we can to make sure that it's done according to the rules before it ever gets to you, and we have to ask for your exception. And that's it. That's variances in a nutshell as far as it relates to environmental health. Does anybody have any questions for me specifically about our procedures here? Excellent. Yeah, thank you, Andy.
Well, your last example that there's no magic to 50 feet, but the homeowner has to say, they have to have a reason why they want it to be 48, other than they just feel like it, right? I mean, there has to be like a reason in the design or where the structure is and stuff like that, right?
Absolutely has to be, yeah. And that goes back to it not being arbitrary, a matter of convenience or a minor cost savings. Yeah, it needs to be something quite legitimate. All right, thank you all very much. I appreciate it.
Are there any questions from the?
Oh, I forgot. Excuse me.
I have one question. So if a homeowner or anyone subject to one of the regulations and they ask for a variance and it's ridiculous, does it still come to the Board of Health, or do you have the option to say, yeah, I'm not taking that one to the Board of Health?
They do in fact have enshrined the right to ask the Board of Health in a number of regulations. So we inform them up front. That's not something environmental health would support. They still have the right to do that, but we're going to give our opinion at the board meeting too. For what it's worth, Todd, I've been here 11 years now. I've only ever seen the board reject one variance, and it was one that we did not support. It was a bit arbitrary, and that's the only time it's really come up here. So it isn't a problem for us traditionally, but it could happen.
Okay, thank you.
Any other questions? Thank you.
Thank you, guys.
Very good. We will move on to the financial reports now.
Sure. So tonight we're reviewing information up through July. So up in the revenue section, we are 58% through the year. So we would want to be at or above 50%, those funds. Remember, it does vary a little bit by season, so we won't dwell on that too much. The general fund account for our largest source of revenue, I'll always look there to see how that one's doing. And it's at 67% collected. That 25% variance seems a little large for that fund. That's also because last year, if you look in the July 24 column, we'd already gotten the second apportionment of property taxes a little early. We typically don't get that until August. So it was paid in a little early, so it's creating a larger variance than what normally would exist. But overall, we're at 67% for what we anticipated, which is good. And then our next largest fund being the Clinical Health Services Fund is at 70%. So both those funds that really drive our revenue are performing well. Overall, for the health department and all the funds, we're at 70% collected. So all things going pretty well there. Down at the expenses, so we want to be less than 58% is the goal. And you can see the majority of all of those funds, including the general fund, which is exactly at 58%, are at that marker or a little below. You have a handful that are either have a grant portion to them or completely grants that are going to be above that. That's because you're spending the money on those deliverables and are yet to get reimbursed. And that especially happens this time of year with the flip over in state fiscal year. So the state then has an extra 30 days to issue payment to us at the end of a grant cycle before they start up a new year. So we are at least 30 days delayed on payment for some of those grants. But overall, we're at 56% for total expenditures. So that's right on track with where we would want to be. And then going all the way down to that bottom right-hand area in the indicator section for the operating ratio for all those, they're starting to round out into alignment as we're kind of approaching the back second half of the year and getting down towards that 100% or a little above for that operating ratio. Again, the ones that are more significantly over that are your grants, and that is also because we either haven't got reimbursed for it yet, or the grant isn't in the time of year where we have put the deliverable in action yet. So we've been spending the cost for personnel, but we haven't done the activity yet to get reimbursed. So those should start to round themselves out as we approach the second half of the year as well. But overall, we're at 92%, which is right on track. Any questions about the income expenditure report? All right. Next report is your voucher summary on your goldenrod. So there are the expenses for the month. Give you a handful of minutes to look through that, and anything you have any questions about, I'll certainly answer. Any questions about the voucher summary? Hearing none, moving on. Moving on. Your final report is your appropriation transfers for the month. So that's on your Sammy color sheet. You'll see a handful of really large ones in there that'll say fees for registers. That is the state portion of the fees that we collect for certain programs that we have to send back to the state. So it's usually done on a quarterly basis. So that's just getting ready to pay those quarterly remittances. It's most common in our EH programs. Any questions about any of the appropriation transfer? All right.
Any questions from the people on Zoom? I would need a motion and a second to accept the monthly income and expenditure report, the voucher summary, and the appropriations transfers. Second.
Second.
All in favor, say aye.
Aye.
Opposed? Okay, motion carries. On to the governance reports, governance committee.
Yes, the governance committee did meet today at 5:30. And reviewed the policies, that, Melissa and the staff had put together for it. There were about 20 policies. General policy updates, and then there are about 20 or 25 IT policies that were done at the request of the auditor. And so those were reviewed. There was nothing eye-raising at any of the policies or the updates, and the committee did unanimously approve to accept all the policy updates. So if you are interested in looking at the policies that we reviewed, they are online, and you are welcome to pull them all up and read them.
We trust you.
Thank you. And I trust the staff. No, I did read most of them.
Trusted, verified.
I trust and I verified.
Any other questions from anybody on the call?
So we just need an approval.
Yeah.
To accept the committee's report.
All in favor, say aye.
Aye.
Opposed? Okay, motion carried. The performance evaluation committee, Bill. And planning and finance, Andy.
No report.
Okay, under new business, we have a resolution from the Agaria Center, regenerative practice. Does anyone want to speak to that or?
Yeah, I can let everybody know. So Agraria is, what would you call it? A farming co-op, a coalition in Miami Township that is operating, a couple of composting units up there under the jurisdiction of US EPA. They're what we call a class 2 composter. And so under our authority, we enforce those EPA rules. There is an option for class 2 composters to exempt them from the rigorous daily record keeping that they have to do. The law, or rather, here we go again, the regulation says that they should keep daily records unless and until the Board of Health allows them to take records, to keep records at a less frequent basis. The composting there is at a smaller scale. There isn't really much going on a daily basis, but more on a weekly or a bi-weekly basis. So while this functionally feels a lot like a variance, has to be done by resolution. It doesn't work like a variance like we just talked about. But we do need the board's approval for them to be able to drop down to less frequent log keeping. And so in this case, we're saying that every 2 weeks would be adequate. As a personal note, we've gotten to know Mr. Eric B., who runs Agraria there in the composting operations over the last couple of years as he got set up with this. And we have every reason to trust that he's going to keep those logs according to this new arrangement. If you approve it.
Any questions? Any questions from?
Yeah, I have one. How often do you visit the facility?
But I think that one is done quarterly. And this resolution does not change inspection routine. They'll still be done every quarter.
Yeah, so if something were to increase, you would find out fairly quickly.
Pretty quickly, yes, sir.
Okay, thank you.
Any other questions? Okay, I will read the resolution. A resolution authorizing the Agaria Center for Regenerative Practice located at 131 East State in Yellow Springs Road in Yellow Springs, Ohio, to enhance operational efficiency by implementing measures to reduce paperwork. Whereas Agraria Center for Regenerative Practice and Ohio EPA licensed Class 2 composting facility is hereby granted a revised terms for record keeping. So be it resolved by the Greene County Board of Health as provided in OAC 3745-56-215, Agraria Center for Regenerative Practice is authorized to compile a log of operations on a biweekly basis, changing the frequency of the self-inspection checklist and not any other log requirements, contingent upon the absence of significant repeated violations, changes in operations, or other circumstances that may necessitate an order from the Director of Environmental Health to resume daily logging of the self-inspection checklist. So I need a motion for the approval of the resolution.
Still move.
A second.
A second.
All in favor, say aye.
Aye.
All opposed? Okay, motion is passed.
Thank you all. Mr. B's writing hand is uncramping as we speak.
Okay, next we have some informational things. It is the 2025 mid-year report.
Okay.
Does anybody wanna?
So every year you get halfway through the year, you get an update on the strategic objectives that the organization is working on related to our strategic plan. This year it's in a little bit different format. I really like the format that Jillian, who prepared this, actually put it in. It gives you a nice summary of what the goals were, what the challenges were, what the status is, on what challenges we're facing, and where we're going. So hopefully you've had a chance to look at it. There's a nice summary in the top part that summarizes just some of the successes that we've had so far, as well as some of the challenges. A few of the challenges have even already been mentioned tonight with some of the reduction in funding. She mentioned the tobacco grant. We've also already mentioned that grant getting reduced by the 28% as well. So we are seeing that. It talks about the food program in there as well, in this provisional status, and then we've already got corrective action plan in place for that. But there's also been some really good achievements and successes as well. So we've mentioned before with the EI team earning that 100% score on their program survey. Also, our audit report for the agency was a clean audit. There was no findings or even comments with our audit. Also, we are eagerly anticipating our reaccreditation that hopefully happens later this month. So we all have that to look forward to. And then, so as you peruse it, if you go all the way through it and get to the back, I like looking at the overall status summary that does a really good job of just outlining really neatly the priority area and then the status, whether it's completed or on track. So you'll see the 5 priority areas are listed, and 2 of them are already completed with what we set out to do this year, and the other 3 are on track. And then there's a nice looking ahead section to the second half of 2025 and what we'll be focusing on.
I'll just add that as this mid-year report, this used to occur every 6 months for the health department. The planning generated documents that were as large as this manual, and then your planning committee and planning and evaluation would review all of this and review and approve them. So this draft, I'll just call it a draft at this point. When the planning and finance committee meet in a few months, any final revisions to all of this will be typos or whatever might be in here. And if they don't like what we're doing, certainly, let us know. But this is the piece of the planning and finance committee that committee reviews and approves for us every 6 months. Probably by the time they meet, we will also be looking at next year's goals and sharing those with that group, because that group decides, is there then enough money to fund things like, well, gee, we need to do something about tobacco, we need to do something about marijuana. So that is the purpose of this report. So please do pay attention to this. This is the culmination of all of those efforts, and the successes and the challenges that we see. But hopefully you appreciate, I mean, we've had a few iterations of this. But this is definitely easier on the eyes than
This
what
was a
the
great
full
one.
manual was.
Very easy to read.
Any questions on this? Any questions from you all? On the Zoom? Okay. Next is the Greene County Public Health Audit Report for the year ending December 31st, 2024.
Yeah.
And
Kind of mentioned that already a little bit in that report, and Olivia was so
oh
thoughtful
my gosh.
to include this 38-page document for all of you. So if you can't sleep tonight, this is for you. Or if you really just want to skip to page 34, that's going to be the outcomes, and you're not going to find any on there because there was 100% compliance and there was no findings or any issues with any parts of the audit. So I mentioned it before to a small group, but definitely want to mention it to all of you. Really, I want to give Evan Dillahunt, who's the accounting program manager, the credit for this team. So he actually in-house compiles our financial statements now. So really want to give props to him and to his team for this report.
Congratulations. And
Yeah.
thanks to that to Evan too.
Melissa said, trust but verify, and it's our.
Yeah.
There you go.
And it's from the planning and finance committee. I mean, this is fantastic. I mean, you asked for a better, I was searching through here, looking for something, right? There's nothing. And that's a point to everybody here. And well done. We are very well done.
Thank you very much. We'll move on to additional business. And that's the certificate of estimated property tax revenue.
Yeah, so as another FYI informational document for you, remember last month you approved the resolution of necessity that went to the county commissioners. They approved it and it's been submitted to the Board of Elections. So we will be on the November ballot. We don't have an issue number yet, but when we get closer, issue number. What this is just it's certifying what the estimated revenue will be from that levy from the auditor's office. So it shows you based on what their estimated property tax values are that the appraisals will be conducted off of. It's estimated to bring in about 3.5 million. And then item 4, about halfway down the page, shows you what that $1 of taxable value for every 100,000 is going to equate to, and it's $18. So
That 3 million or 3.5 million, is that for the whole 5 years
no, that's per year.
per year? Okay.
Yeah, it's called a 0.8 mil 5-year operating levy, and it only supports the operations of the health district. We can't use it for other things, but I do think it's important that people understand we're probably one of the smallest levies in the county. And just like the $3.5 million is for the entire year, the $18 per 100,000 of a property value is for the whole year. You know, it's not, I mean, if you have a $500,000 home, sure, it's $100. But this is 18, if your home is only worth 100,000. You get so much.
That's right. Yeah. Any other questions? Okay. Is there any additional business or comments anyone would like to make? Anybody on Zoom? Any comments you'd like to make or? Okay.
Well, I'd like to ask, how did the adult deciding go, and did we get to use the drone?
So we haven't used the drone for adult deciding yet. The attachment for larviciding was shipped today, so we'll have it by the end of the year. I'll tell you that our struggles with mosquitoes this year continue. received notice today that 12 positive pools are mosquito pools tested positive for West Nile. And that's in 6 different areas. So as of Monday evening into Tuesday afternoon, we'll be applying treatment again in some of those, well, in all of those areas especially. So we've put out a number of press releases. Laurie has stayed on top of our social media posts to inform folks to personally protect themselves from mosquito bites with just some practical measures. And we're doing everything we can with outreach. I will go ahead and brag a little bit on the use of our mosquito control program funds. Every year we apply for funding from EPA for mosquito control. And this year we did something we've never done before, and that was hire an intern. So we got a college student, Katie Rich, who's a biology major. Environmental science major at Wright State. So she's working nearly full time for us each week, just trapping for mosquitoes. So the reason perhaps that we're seeing so many positive pools is because we're getting so much sampling done. It needs to be done in lots of different areas this time. So now we're not treating blindly. We're getting good data and we know where to put the juice down. So.
Thank you.
But we also had the discussion too of how as, home development occurs, sometimes it's almost encroaching on wetland areas. And so therefore we think that if there are bites going on or the risk of getting something like West Nile virus could actually be higher because we know a mosquito can only fly so far and homes are being built closer to those areas where they are, so.
Dr. Sheriff, do you have anything to share?
Well, it's interesting. It's kind of, I was going to mention the mosquito situation in West Nile. And this would be a good opportunity for me to kind of piggyback on Chadwick there, is that you guys may not realize that some of you may not, but the health department partially sponsors a radio spot that we do every week on the radio. And we try to talk about 3 different health issues. Spend about 3 minutes on each issue. And one of those is always tries to be a public health issue. So we've talked about mosquito mitigation and the West Nile virus and all of that. So that kind of is also another way that the word's getting out. This is kind of a quiet time of year. I will mention, I almost have disdain to talk about the COVID virus. But you may have been hearing the press has been talking about the summer surge, this and that. But when you read beyond that, really this summer has been the lowest levels of COVID that we've had. It's been the latest increase in COVID. We have seen increased COVID based on the last several months. We have seen it in the office. It is here in the Greene County. Cases fortunately are mild. For the most part, they're mild. Obviously, if someone's and pardon this, don't be offended, but if you're circling the drain anyway, it doesn't take much to push you in. But having said that, that's corners. Yeah, it is. Having said that, for the most part, the COVID cases have been mild, and it has not been a surge. In fact, it's been less than what's been anticipated. I guess one of the new developments this week, up till this week, the CDC has recommended COVID vaccine, essentially the same as the flu vaccine. If you're 6 months of age and older, no matter who you are, you're eligible or recommended to get the COVID vaccine. And the CDC came out this week with kind of I don't know if it was a surprise. It was a little bit of a surprise by me. But healthy children and healthy adults, it is should be discussed with their primary care provider, and it's now not necessarily a recommended vaccine. I think there's several reasons for that. Number one, the new director of Health and Human Services has obviously a different opinion on vaccines, and that's coming down. But the other thing is unless an updated COVID vaccine comes out, we're dealing with an old vaccine in terms of COVID that does do what it's supposed to do and increase immunity to a variant that we haven't seen in quite a while. And so, technically there's some benefit, but there's a lot of debate in the healthcare world about whether it's relevant or not. And so I think there's a lot of things going on. It'll be interesting to see, if there's an updated vaccine. They definitely have the technology to produce an updated vaccine. It comes down to a financial decision whether the vaccine manufacturers feel like that it's worth them developing an updated vaccine. So it's going to be interesting to see if there's an updated vaccine. If there is, it needs to become available here fairly soon. We're getting into fall vaccine season. And it's going to be interesting to see what the CDC, how they maybe revamp their vaccine recommendations. So the announcement was made this week that they're definitely looks like they're posturing to make changes. So that's about it in terms of anything really happening right now.
Thank you. Melissa, do you have anything?
No, I have nothing. No, thank you.
Anybody else have anything to add? Okay. Thank you, those of you that are on the virtual call. I appreciate you being part of it. If there's nothing else, then we'll adjourn.
Thank you.
Thank you.
What? Yeah.
Got 6 months. This is